You're listening to the Applied Natural Medicine podcast, showing how the science of naturopathic, integrative, and functional medicine is applied by clinicians in real-world practice. This is a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005.
Hello, everyone, and welcome to the Naturopathic Doctor News and Reviews Applied Naturopathic Medicine Roundtable. I'm your host, Dr. Kareem Kandil. Applied Naturopathic Medicine presents clinical cases from practicing naturopathic doctors, cases that illustrate the application of naturopathic medicine in real-world patient care. As NDNR marks 20 years in publication, we're grateful to Activation Products for supporting this. And for today's roundtable discussion, bringing in Dr. Mikhail Friedman, and this is going to be based on the topic that was in our 2025 June issue on neurology and mind-body medicine on tauroursodeoxycholic acid, or TUDCA for short, and its protective role against neurodegeneration. I'd like to again remind the audience that you can access NDNR's continuing education platform for additional learning opportunities. So our guest for today, Dr. Mikhail Friedman, is the founder of Restorative Formulations and the current president as well. He is the author of the recent book, There's No Pill for This, a naturopathic physician's personal prescription for managing multiple sclerosis. He is also the founder for the Association for the Advancement of Restorative Medicine, the AARM, and the Journal of Restorative Medicine. He's also the author of the medical textbook, Fundamentals of Naturopathic Endocrinology, a contributing author to Evidence-Based Approach to Restoring Thyroid Health, and co-author of Healing Diabetes. He has treated patients with many illnesses ranging from lymphoma to liver cancer, achieving remarkable results that have been published in several medical journals, and practices and lives with his family in Vermont, USA. Welcome, Dr. Friedman.
Thank you.
Dr. Friedman, let's just start with your opening perspective on why TUDCA is generating so much attention in both research and clinical practice. I'm definitely seeing it trending a little bit more, but tell us a little bit about it and why it's so important.
We'll start off with the name, the tauroursodeoxycholic acid. Tauro is for the taurine, which is bear, and urso means orso, O-R-U-S-O is in French, it's bear. Urso minor is the stars for the big bear, big dip, and it has to do with, it's named after the bile which is found in bears. So bears, they found, especially Asian bears, to have copious amounts of TUDCA, and they found that in the bile acids. And that is what really led to the understanding of hibernation. Because hibernation, think about it, the bears sleep on average 3 to 7 months. That's a long time. You would normally think that their skeletal muscle is going to go down, their gallbladders would stagnate and get gallstones. You would think that with such low metabolic rate, the brains would have organ damage. There would be a lot of metabolic diseases and liver disease when nothing's moving and the cholestasis is not moving. And that's when they found that actually TUDCA actually is this compound which helps the bears to be completely healthy, which is able to handle 7 months of sleep, which is, when you think about it, is a huge physiological stress in the body to go into such a low metabolic rate for a mammal in 7 months. And it's the TUDCA, which they found is the key thing. And the TUDCA can do so many different aspects of preventing the organ damage. It prevents cholestasis, so the gallstones don't form. It also is neuroprotective. It protects the brain and actually all the cellular tissue, because undergoing this severe metabolic strain normally would cause endoplasmic reticulum stress on the mitochondria. It protects the mitochondria because the TUDCA actually will acts as a chaperone to help with endoplasmic reticulum health. And it also helps with like anti-apoptosis and anti-inflammatory. Imagine if we just slept for 7 months. Look what our muscles would be like. Or we wouldn't live. But anyways, we look at what it does in hibernation is what it's being studied in animals and in humans. So in humans now, if they're using it in different forms and for different treatments. So for example, in Italy, it's approved for cholestatic liver disease. It's also approved as a drug for primary biliary cirrhosis. By the way,
wow.
Primary biliary cirrhosis is treated with UDCA, which is a bile-acid without the taurine prescription drug. And that's the only thing which saves people from dying in primary biliary autoimmune cirrhosis.
Mhm.
But it's approved, TUDCA actually is approved in Italy for all cholestatic liver diseases and other liver diseases. And in the United States, it's actually a prescription drug when TUDCA is mixed in with phenylbutyrate for the
Oh, okay.
treatment of ALS.
Interesting.
Approved as
Okay.
a drug for ALS only when it's mixed in with phenylbutyrate. And
Okay.
phenylbutyrate it's a short chain fatty acid that the
Mm.
gut produces mixed in with TUDCA, and it's a prescription drug, and that's used for ALS. But there's a lot more studies coming out on different things, and for insulin resistance, it's shown to really increase insulin efficacy by 30% in some studies. And the studies by itself for ALS are coming out mixed. Some studies are showing it's
Mhm.
working really well and increasing pulmonary function in patients with ALS. But some studies are not doing as well as we thought they would. But it is promising, especially when you're adding the butyrate. Treating ALS it's a very depressing thing to treat because almost everybody dies pretty quickly.
Mhm.
But any extenuation of life can be of benefit. But there's one study using TUDCA mixed in with pterostilbene, which is a
Mm.
flavonoid in blueberries, and with nicotinamide riboside. And nicotine that has shown to actually be effective in decreasing the speed of progression in ALS versus placebo. And also, I did treat a patient with ALS, and the person was on a feeding tube and couldn't move anything. She was 35, she had children. She couldn't breathe by herself. She needed a ventilator, which is standard course of ALS. But we gave about 2 grams of TUDCA along with pterostilbene in a formula I designed called NeuroPX Extra Strength. And she was able to take it. It didn't help any of her muscles, but it was so advanced. But she was able to feel alert and her mind was able to think.
Mhm.
She was able to communicate a little bit with her throat, and she said she felt so much more alert. And she was someone who was very prayerful, and she spent a lot more time praying. So she was very grateful that she was able to stay awake and pray. And the interesting story about this is like more a personal story, but I have multiple sclerosis, and I was reading the notes from my neurologist, and on the notes, on the neurologist said that they were considering that actually I was misdiagnosed with progressive MS, but I might have ALS, and my symptoms were more consistent with ALS than MS. So the running diagnosis was either differential on the notes was like progressive MS or secondary progressive MS or ALS. And when I saw that, I was like, oh my God, I got kids. It's a big deal. I was like, I'd rather have MS, but if I have ALS, let's do everything possible because the quicker I got it, I got to work on something quick. That's when I started mixing in pterostilbene with TUDCA and nicotinamide riboside. And I started taking it and I started getting better. And fortunately, during that time, for the 3 months before I had to get tested for ALS, like the worst test possible. If you know those tests for ALS, but they're like really painful. And it came out negative. So I was like, oh phew, I don't have ALS. But my symptoms were still consistent. So they did it
Mhm.
again. And it came out negative. So I do have the diagnosis stays with MS, but I did improve and I had a harder time walking. I had some ataxia. And after doing this, I really improved to the point where on a good day, I can ski double diamonds. So it really improved me and my mental clarity improved. And there are some studies using TUDCA on its own for progressive MS. There are preclinical studies, in clinical practice, I've used TUDCA along with all these ingredients, pterostilbene and nicotinamide riboside mixed with ashwagandha. Anytime I think there's issues of endoplasmic reticulum stress.
Mhm.
So I've used a great case study is I used it in a patient with COPD.
Mm.
See, chronic obstructive pulmonary disease. There's a lot of evidence there's mitochondrial death and mitochondrial
Mhm.
A and stress from all the smoking. And even after you stop the smoking, there's higher senescent cells and aging quickly.
Mhm.
And autophagy is part of impaired. And so I gave patient TUDCA along with fisetin And the person was able to, before treatment, walked 5 to 10 minutes, and after 30 days was able to start walking 45 minutes.
Wow.
So that was an example where, wow, there's so many places where this can help. And one doctor who used this product called Neuroprotection in extra strength in Canada, she said her patient with Parkinson, she gave 6 capsules a day, which is a very high amount. And she said her patient for Parkinson's improved significantly within 2 months. And that, just the fact that, like, in neurological diseases, they don't call things treatments, they call things DMT, disease modifying therapies, because this was a thing which actually helped the patient instead of just progressing less. It actually reversed some symptoms. So some exciting stuff out there. And it certainly hasn't helped all my patients. I've tried that. ALS patient still died. I've used it in patient with cortical atrophy, didn't help. I did use it in one person. I did use it in a patient who had a gallbladder, when the person had a gallbladder, what do you call it, biliary dyskinesia, when they had less bile-acid. The person young, 30, and had less memory suddenly after she had less bile. And I looked it up. And it was saying that people who have gallbladder removals are higher risk for getting senile. And that's when so I gave the patient TUDCA, and her memory improved significantly within 6 weeks back to baseline. So that was an exciting case. And the thing about TUDCA is it crosses the blood-brain barrier. It helps with, it actually helps, there's bile-acid receptors in different parts of the body, including the brain, and it helps with autophagy. And so it helps clearing of toxins in the central nervous system as well. And that's why it's helpful in the brain. And that's why bears are still smart when they wake up.
No, it's very fascinating. I think oftentimes when we learn about bile acids, we tend to have a very oftentimes localized understanding of their role in the GI tract to help emulsify, absorb fats, playing an important role in our hormone metabolism. But I guess we tend not to think about these kind of systemic effects intracellularly. You were talking about supporting with ER stress and protein misfolding, but signaling aspects on the mitochondria to support autophagy, some of its immune mechanisms, and especially in the clinical context of neurodegenerative disorders, and its ability to mediate that astrocyte and microglial activation, which is oftentimes that immune driver of some of that neurodegeneration.
Yeah.
So I think it is something important for people to realize that, again, the intelligence of the body is very significant. And again, these bile acids play a very critical role, but again, we can have imbalances in different directions. And I know you in the article mentioned some of the imbalances between our primary bile acids, cholic acid versus deoxycholic acid, and how these bacterial metabolites and some of that kind of gut dysbiosis can oftentimes drive these imbalances in the healthier, more optimal bile acid ratios. And I know that we mentioned this was originally derived from bears, since we produce a lot of it. We produce it, but nowhere near on that scale of bears, and hence that kind of TCM use, traditional Chinese medicine use of bear bile and other indigenous cultures because of some of those unique effects. Speak a little bit to how we can have these imbalances in our bile acids, different conditions, and especially some of the risk factors that may come from a lot of the medications. GLP-1s, we know, are going to definitely impact that overall gut motility, which is going to, of course, impact microbiome populations, impact the mobility and the appropriate turnover of these bile acids. So I'd love to hear your thoughts on that.
Well, I'll just talk about what I know, which is that there's a lot of things I don't know, but like the bile acids from the gallbladder is ursodeoxycholic acid, and it becomes tauroursodeoxycholic acid because it conjugates. Conjugation happens in the GI tract. Without the bacteria, it doesn't conjugate. So having a healthy gut flora is going to increase butyrate too, which is the drug for ALS, or they're mixing butyrate and TUDCA. So our body's own production, endogenous production, also in a sense starts not only with the bile, but starts with the microbiome and a good healthy gut flora. And then if you don't have a good, healthy gut flora, you're also going to have a cytokine release, which it also can disrupt the blood-brain barrier. So I think the body is so holistic. It's amazing. Um, the first time I learned about bile-acid receptors was at our conference from an endocrinologist, who
Hmm.
was talking about the impact of bile acid receptors and its conversion of T4 to the active T3 liothyronine. And
Hmm.
that blew my mind. I was like, bile acids. And then I heard about it from Jill Stansbury talking about as an herbalist using bitters, how
Hmm.
bitters will help
With
stimulate bile acid receptors. So it's amazing, the body.
yeah, it's there's so many interconnections, and even with regards to kind of like the gut microbiome, it's kind of interesting sometimes, kind of chicken egg situation in terms of how you're chasing it. Definitely having an imbalance in the gut microbiome is going to result in imbalances of those conjugated bile acids, as well as maybe decreased amounts of butyrate if we have dysbiosis. But by
Yeah.
going out and supporting that, we're supporting the health of the gut, which also in turn helps further support the microbiome, which can hopefully help to correct those imbalances over time when given supplementary.
Yeah, there was one study where they were able, in an animal study, they were able to induce demyelination by causing dysbiosis in the gut flora in mice, and they're able to reverse it with antibiotics. I mean, that's pretty amazing.
Yeah, and reason why, for again, there are some patients, I know that as a community, medical community, as patients at large, there's definitely concern of the overuse of antibiotics historically, but there are definitely many patient cases where they do have such an imbalance, and what they do need is a good dose of antibiotics to
Totally, yeah.
clear things out, reset, and
Yeah,
then we can help to maintain it with the adequate diet, prebiotics, postbiotics, and herbs that will support like a healthier gut
yeah,
terrain.
yeah, absolutely.
Obviously, talking about TUDCA, the fact that its ability to cross the blood-brain barrier, something that makes it very bioavailable within that central nervous system, where again it can support cellular energetics, help avoid cellular senescence, obviously aging, which kind of goes hand in hand with metabolic dysfunction, as metabolic dysfunction will accelerate that cellular aging process. How does TUDCA fit into that, especially with metabolic dysfunction? I know there was some of the studies looking at flow mediated dilation given a hyperglycemic load, and how TUDCA was actually able to attenuate and prevent that decrease in blood flow due to the imbalance of hyperglycemia.
It helps with insulin. That it would help with that. To be honest, my focus has been really using it for endoplasmic reticulum stress. I know it does so many things with metabolic, but my brain's been so much. All my PowerPoints are about focusing on this.
So that's actually something I
So
want
you
to.
know more about it than I do. So you tell me.
No, on the contrary, I'm always open to hearing what you're finding in the research and kind of those perspectives, because we definitely talk about ER mediated stress in med school. We understand how drugs and toxins can impact that function, and how misfolded proteins are going to basically clog up that machinery within our cells. But when again you're talking to a patient, obviously talk about, endoplasmic reticulum stress and protein misfolding isn't going to probably make much sense, but conceptually break down why this is such an important part of cellular physiology that we're oftentimes maybe overlooking when considering addressing and creating the conditions for health.
Yeah, because the cells need to clean itself out.
Mm-hmm.
Naturopathic medicine, we always talk about like detoxifying and how does a cell clean itself out? It's through autophagy. And what is the best chaperone for autophagy is it's going to be things such as TUDCA to help stimulate that and I'm sure there's many other things as well, but that's one of them. And the other one, which helps detoxify the the central nervous system, is the glymphatic system. So we want to work on helping autophagy. We also want to work on helping the lymphatic system. And when I went to school, we learned about the lymph system in the body, but I didn't know by the brain had a lymph system, but it does. And that lymphatic system only gets turned on when you sleep.
Mm-hmm.
So a lot of the traditional naturopathic or traditional thoughts in medicine in all societies is sleep enough, eat well. All these holistic things are all still really important. Sleep enough, eat well. That's the basics.
Yeah, and that's again makes a kind of very good point as to how TUDCA can be a good adjunct in aiding in that cellular detox for people, because a lot of the reason why people are coming in and why their health has gone off the rails is sleep disturbance. And I think we're continuing to see increases in that as everything from light exposure and people's habits disrupt that. So they're already coming in a state where their lymphatic system doesn't get the opportunity to do the job completely. And so definitely another way of sending that signal and supporting the cells and the body to be able to do this can be a great way of helping to support that patient as they're working to rectify their lifestyle and improve the quality of their sleep and hence their detox capacity, along with everything else holistically, the diet, the movement, all of it.
Yeah, do you know that if people are not sleeping well enough, because of, for example, apnea, and one of the reasons that an apnea machine can, on average, extend someone's life by 5 to 10 years is because not breathing while you're not breathing while you're sleeping increases aging and senescence, and that senescence can cause a whole host of problems, even osteoporosis. I know someone who got osteoporosis from apnea. I would never thought of that reason, but it's all kind of mixed. It's a whole package. Sleep enough, eat well, and take your herbs and eat bitter foods too. If I'm just eating processed food and not eating anything bitter, that's not good.
Just like you mentioned, we have these bile-acid receptors, we have these bitter receptors throughout our GI tract, and all of that, it's all about signaling at the end of the day, the energetic signaling, and that if we're just pumping in excessively for one area and leaving other areas uncovered, we're creating the conditions for imbalance. In terms of use of TUDCA, again, this is it's available, at least in the United States, here freely over the counter. It's not currently a drug and hopefully doesn't make it onto a list to get restricted in that way. And again, something the body makes endogenously. It's been used therapeutically, both from a TCM perspective and then again from a nutraceutical perspective for years and years. But are there any sort of safety considerations that clinicians should consider, or dosing strategies, or any sort of absolute contraindications they should keep in mind when they're thinking of using TUDCA? Any that you're aware of in the literature or have seen personally in clinical practice?
Okay, so let's start off with dosing. If someone has a severe neurological illness like ALS, the studies are like 1.5 to 2 grams a day. Personally, I take 500 milligrams a day, and that's enough for me. In terms of side effects, in terms of the studies, the main side effect people noticed was mild diarrhea, but it is a bile acid. It's an acid, and an acid can really hurt the stomach. For me, it hurts my stomach if I take it on an empty stomach, so I have to take it with food. So I would say the main thing is if it hurts your stomach, take it with food, and if it's really bad and it really irritates you, if you already have gastritis or something, or your stomach is very sensitive to even a cup of coffee, for example, you could take something to coat the stomach, like slippery elm or marshmallow root. If it's real severe cases, I've even recommended sucralfate, like 45 minutes before taking the TUDCA. But in general, most people tolerate it. It's better tolerated with food in terms of to help with preventing the acidity hurting the stomach. And that's really the only thing I've seen and heard of. It's quite well tolerated, but it really can irritate the stomach to the point where someone can't. I've seen some patients where they even took it for 3-4 days and it just caused really intense stomach ache even after they stopped. And then they needed some things like DGL to coat the stomach for weeks to get better. So it's, for some people, it can really hurt the stomach.
Okay. But are there any sort of like acute gallbladder conditions or severe gallbladder conditions where it might be contraindicated, or generally speaking seems to be tolerated?
I would say it's helpful to prevent gallstones. Actually, one of the indications to prevent gallstones.
Yep.
Yeah, that's a good question. I'm not aware of it, but it doesn't mean that it's not something I'd be.
Yeah, there's always, we have to consider possibilities, but it's at the same time, it's like if we haven't really come across it clinically, anecdotally in the literature, then it's probably not something to be concerned about, because ultimately
Right.
that's something I think a lot of patients may feel a little bit that may be a concern, but good to know that again, since this is something that is endogenous, it is pretty well tolerated, and there are definitely ways to mitigate effects if you have an extra sensitivity to those bile acids.
Yeah.
I know you talked about a number of compounds that seem to work well in synergy, the Terastil being the Visitin. Are there any other neuroprotective or nootropic compounds you find really stack well with TUDCA or may have an enhanced bioavailability if taken with it in order to help support
Right.
neurological health?
Ashwagandha is helpful. Turmeric essential oil,
Mm,
curcuminoids. All those things work great together for neuroprotection. So a lot of the adaptogens, which are also have a brain focus, such as curcumin, bacopa, those are all the ones also I would consider using at the same time.
okay. Where do you see the next wave of TUDCA research heading? I know that definitely a big area of your own personal practice and focus, your own life
But
journey, and the focus of the article is on neurodegenerative disease, which is definitely a growing and kind of scary part of medical challenges ahead. But
the MS, or there's random clinical trials right now for they've done pre-trials and now they're trying to get to the next level one and phase two trials for
mhm,
like progressive MS and for Parkinson's. So
okay,
that's where the research is going right now is in those two things.
excellent. And as a practicing naturopathic physician, what role do you see naturopathic physicians playing in shaping the conversation around compounds like TUDCA and interacting with and collaborating with mainstream neurologists or other physicians whose patient base may benefit from this?
I learned about TUDCA from my neurologist. And a lot of neurologists do recommend TUDCA, by the way.
Awesome.
It's they might not say they might not they'll just say you should. I know quite a few neurologists who have told their ALS patients to try TUDCA because there's really not that many options out there. So I
Mhm.
know it's being used and recommended. But I think it's another tool in their tool chest that naturopaths would really consider. It's more expensive. It's relatively a more expensive ingredient than, let's say, milk thistle. I think when you're looking for something, when you need, when it's like a serious, when it's a pathology and disease, and you need to make a big impact, you probably, this is something I would definitely consider. And by the way, just people wonder, is it made from bears? It's not made from bears. It's synthetically conjugated with
Mhm.
taurine. The bile acids originate probably from byproducts from the chicken industry. That's where it's coming in. But a lot of amino acids are like that as well, by the way.
Or
And
fermented bacterially or something of that
yeah,
nature.
and yes, but TUDCA, yeah, the orsodeoxycholic is not fermented anyway. But it's a powerful thing in the tool chest, and but it's also humbling. Sometimes you'll treat something and nothing works too.
Yeah,
But definitely I've seen things where milk thistle wasn't enough, and this was helpful.
that's going to be the thing with any intervention and treatment. There are going to be people who benefit, and there'll be people that, as much as you want it to work, it won't work with them. But the whole point is you have something that is, again, it's not the cheapest supplement out there, but definitely far more accessible than some of these very expensive experimental type of drugs or some of these immune modulators might be in that regard. So it's something that it's accessible in that regard, pretty safe, and something that seems to have a lot of
Yeah,
promise in a lot of these populations. So I think it's definitely something that will be great to see more clinicians using, and good to see that there are conventional physicians that are also opening up to this and dealing with some of these more severe cases.
yeah.
I
Yes, and
mean,
I've even put it in a feeding tube in an ALS patient, and she noticed a difference already in a few days cognitively. So,
that's amazing. That's again, it's a pretty cool product. We've talked about its properties as a chemical chaperone, its support mitochondrial health with ER stress signaling, and its ability to help support neurodegenerative and metabolic disorders. And of course, again, very useful and powerful clinical tool for clinicians to use. Any final thoughts you'd like to leave our practitioners with in regards to TUDCA or naturopathic medicine in general?
feel free to email me if anyone has any questions about using it in clinical practice.
Mm-hmm.
I've seen really good results with it.
Yeah, absolutely. And I think you gave some really good information on the doses and some of the uses and how to best take it and how to mitigate some of those effects if need be. Again, I want to thank you again, Dr. Mikhail Friedman, for joining us today on the Applied Naturopathic Medicine Roundtable. And again, I'm Dr. Kareem Kadil. For complete case studies, clinical protocols, and naturopathic medicine continuing education, please visit us at ndnr.com.
All right. Thank you.
Thank you.
This has been the Applied Natural Medicine Podcast, a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005. Access the full archive of case reports and clinical insights at ND. For subscriptions, partnerships, or submissions, contact us at editor